Hi, this is Frank with a Frank Opinion. Today I'm presenting part 4 of a 6-part series that I've called The Failure to Enact Medicare for All is a Unique American Failure. And part 4, I'm titling it, Bernie Sanders, Why? A few years ago, Bernie Sanders produced a paper called Options to Finance Medicare for All. In it, it has 12 options. The first 2 options are as follows. The first, a 7.5 payroll tax excluding the first 2 million in payroll. He might have revised that to excluding the first 1 million in payroll, but in the paper, originally, it was excluding the first 2 million in payroll. So we're not talking about mom and pop stores, we're talking about fairly large companies, mid-sized companies and up. The second option was a 4% tax on household income minus the first $29,000 of that household income for a family of 4. So let me give you an example of how this might work. A Mineola, New York family. This Mineola's in Nassau County, New York. Dad 50, mom 45, children 15 and 12, and their household income happens to be $118,453 for this example. And the reason for this number here is because it's the 2019 Nassau County, New York median household income. If we compare what this family would pay for private health insurance, which would not be the same or equal to a Medicare for All comprehensive plan, the private insurance would cost them, believe it or not, $25,610. You put the variables in terms of dad, how old, mom, how old, kids' ages, and then you divide their annual income by 12, and it'll tell you whether they are eligible for a subsidy, but it'll spit out what the cost of the insurance is on the different plans. A platinum plan, Fidelis Platinum ST, would cost $25,610. That same family, under Medicare for All, the second option of Bernie's proposal, a 4% tax devoted to health, would be $3,578 all in. No co-pays, no co-insurance, no premiums, no deductibles. This particular plan is not all in and does not cover everything. The savings for this family in Mineola would be $22,032. A substantial, I believe you would agree, amount of money. By the way, you can get this information from NewYorkHealthInsure.com. You put in your family's variables, and it'll give you the plans that are available. The average estimate of additional revenue needed to implement Medicare for All, according to 3 recent studies, the Political Economy Research Institute, and I believe that's November of 2018, the more recent one, Lancet Yale, which is February 2020, and the Friedman second study of 2018, December, their average for how much money would be needed in addition to what we're already allocating towards health in Medicare, Medicaid, Child Health Plus, veterans, etc., would be $900 billion. That's after taking into account the following: removing the predatory private health insurance system and regulating pharmaceuticals and providers in an adequate way. The estimated revenue raised, according to the paper, by Bernie's first 2 options is $740 billion, pretty close to the $900 billion, and we haven't even touched on the other 10 options that he has to come up with the money to finance Medicare for All. He doesn't have in here, by the way, reducing the Defense Department budget. I might have included that. In any case, this is not far off. 900 billion easily raised by allowing individuals and families to fund their own insurance at a 4% tax and payroll, including government departments, to go to a 7.5 payroll tax. Two benefits. No one would be uninsured, no one would be underinsured. It eliminates unnecessary deaths that are estimated at $40,000 deaths a year because of being underinsured, uninsured. All workers would benefit. One of the biggest benefits would be not being shackled to your job because it provides you with health insurance and another job may not. 95% of Americans would probably see a cash flow benefit, or close to 95%. Now, how do I arrive at that? Because the census lower household income threshold for the top 5% of families in the United States in 2019 was $270,000, meaning once you reach $270,000 in household income, you're considered in the top 5%. Everybody below $270,000 would not be in the top 5%. All taxpayers would benefit. Why? Because you are paying for the health benefits for government employees at the federal, state, and local level. And to give you one for instance, a teacher here in a local Long Island, Nassau County school district, the fringe benefit package that is provided by her employer, school district, is 26% of her salary. That does not include the premium that she's paying to United Healthcare, which is the insurance company that is providing the insurance. So when you combine her contribution in the form of premiums, co-pays, deductibles, etc., plus the district's fringe benefit package in the area of health, the total cost is way beyond the 7.5% payroll tax devoted to health care that they would be paying under Medicare for All system. So my question is why, Bernie? Why has this paper been kept essentially secret? On a National Nurses United Zoom call to encourage citizens to get involved in the Medicare for All movement, I asked in the chat area, I provided this information, and I asked, well, this looks so simple to fund Medicare for All. Why hasn't Bernie talked about it? To which the lead organizer answered me specifically and said, quote, Bernie doesn't want to get into the weeds. This is a direct quote. I haven't added or subtracted anything from those words. Bernie doesn't want to get into the weeds. Well, it seems to me that with his options paper, or someone coming up with something similar, Medicare for All is eminently doable. And it's been kept from us essentially because we weren't trusted with this information. We somehow weren't thought to be intelligent enough to understand this. So I'm asking you, as advocates for Medicare for All, what are you going to do with this information that you have today? I encourage you to talk amongst yourselves and your family members, your co-workers, your neighbors. Get involved in the Medicare for All movement. Add this information into your quiver, into your toolbox for advocacy, and let's get this done. Thanks.